motion exercises help the patient to improve their joints by moving in a different directions. Movement will help to keep the joints flexible, to reduce pain, and to improve balance and strength. So now we're going to perform the range of motion exercise. So in this procedure, i-check lang natin yung range and yung strength ng kanyang muscle from upper extremities or hanggang lower extremities. So, before you do this procedure, don't forget to introduce yourself, perform hand hygiene, and set privacy with your client. So, good day, Sir Francis. I am Nurse Rhea and I am here to perform a row exercise. Are you okay with your position?
Yes.
So roll the client in the side and do the hyperextension of the shoulder. So gagawin natin yung hyperextension ng shoulder. 1, 2, 3. Okay, and then balik na po tayo. And the extension and flexion of the shoulder. Hold lang natin to. Flexion, extension. Flexion, extension. And next is the adduction of the shoulder. Adduction, adduction. Abduction, adduction. Abduction, adduction. And next is the flexion and extension of the elbow. And next is the supination and pronation of the elbow. Supination, pronation. Supination, pronation. Supination, pronation. And now let's proceed to the wrist. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Flexion, extension. And then, ulnar flexion, radial flexion. Ulnar flexion, radial flexion. Ulnar flexion, radial flexion. And next is the flexion and extension of the thumb. Flexion, extension. Flexion, extension. Flexion, extension. And the adduction of the thumb. Adduction, adduction. Adduction, adduction. Adduction, adduction. And the opposition of the little finger. And now let's proceed to fingers. The flexion and abduction of the fingers. Adduction, abduction. Adduction, abduction. Adduction, abduction. Adduction, abduction. Adduction, abduction. Adduction, abduction. And the flexion and extension of the fingers. Flexion, extension. Flexion, extension. Flexion, extension. And after that, let's proceed to the leg. So, expose lang natin itong isang leg. So, what we're going to perform is we're going to do the abduction, adduction, flexion, and extension of the leg, and also the outward and inward rotation of the leg. So, first is flexion and extension. Flexion, extension. And the abduction, adduction of the leg. One. And the inward and outward rotation of the leg. Inward rotation, outward rotation. Inward rotation, outward rotation. Inward rotation, outward rotation. And now let's move on to the flexion and extension of the knee. So, flexion, extension. Flexion, extension. Flexion, and extension. Now, let's move to the ankle. Plantar flexion, dorsal flexion. Plantar flexion, dorsal flexion. Plantar flexion, dorsal flexion. Inward rotation, outward rotation. Inward rotation, outward rotation. Inward rotation, outward rotation. And we're going to do the abduction and adduction of the toes. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. And now we're going to the flexion and extension of the toes. Flexion, extension. Flexion, extension. Flexion, extension. And that's it. After that, cover na natin ulit yung area. Repeat that sequence on the other sides, and after that, perform hand hygiene. And that's the end of the range of motion exercise. So now we're going to perform the positioning of the client. So I will show you how to place the clients in a supine and lateral position. And before you do that procedure is, don't forget to perform hand hygiene, introduce yourself to the clients, and gather your supplies and equipments that you will be using for this procedure. So after performing hand hygiene, I already gathered my supplies, and I have here 3 pillows that we are going to use on this procedure. So first is, i-place muna natin yung client natin in a lateral position. So ang gagawin natin is gagamit tayo ng isang pillow, and i-place ko po kayo sa lateral position para mas maging comfortable kayo, and tulungan ko po kayo. Guide natin yung back ng client. 1, 2, 3, move. And lagay natin tong pillow sa kanyang likod and push. Okay. And after that, kunin natin ulit yung isang pillow and ilalagay natin dito. And yung isang kamay dito. And next is lalagyan natin ng pillow yung kanyang legs. So, yeah. So, as you can see, yung paglalagay natin ng pillow is, andito yung knee. Nasusupport siya ng pillow, and also itong lower part. This is the lateral position. Now is, place naman natin yung client in a supine position. So, ipo-position naman natin yung clients in a supine position. So, lalagyan lang natin ng pillow. This side. And ganun din dun sa kabilang side. And also, lalagyan din natin yung ng pillow yung kanyang legs. Para mas maging comfortable. Comfortable lang po ba kayo? And that's how you do the positioning of the clients in a supine and lateral position. Now, I am going to perform how to assist the clients with ambulation. In this procedure, we're going to use the gait belt to assist the client with ambulation. Before you start in this procedure, don't forget to perform hand hygiene and gather your supplies and equipments, and don't forget to introduce yourself to your clients. So, hi sir, I am Nurse Rhea, and now i-assist ko po kayo. At yung client natin is naka-elevated yung position niya, And also, bago natin to gawin is, i-sure natin na mababa yung bed para pag pinaupo natin, yung pag place natin yung, pag pinosisyon natin yung client sa sitting position is nakalapat yung kanyang paa sa floor. So, ang gagawin natin is gagayad natin yung client natin in a sitting position. So, 1, 2, 3, push. And next is, gagalaw naman natin yung kanyang, wait lang. Yung kanyang, 1, 2, 3. Yeah. And, okay. So, ngayon, ang gagawin natin is, lalagyan natin ng, ask din natin ng client kung kamusta yung pakiramdam niya, wala po ba kang nararamdaman pain na ngayon. So, ilalagay na natin itong belt gate. So, make sure na kapag ilalagay nyo to is hindi ganun ka, yung may space pa dapat. Yung kaya pang i-shoot yung daliri. And then, after that, bibilang tayo ng 3 and patatayin natin si sir. Alalay lang. 1, 2, 3. Okay. So, lalakad tayo, sir. Okay, 1. So, dapat nakasupport kayo sa harap and likod. And then, open yung client. 1, 2. Okay. And that's the end of this procedure. Perform hand hygiene and don't forget to ask your client if you feel pain or... And huwag niyong kalimutan na tanungin yung client kung komportable na ba siya sa position niya. So now, ang gagawin naman natin is TPR. Kukunin lang natin yung temperature, yung pulse rate, and respiratory rate ng ating clients. Bago nyo gawin ang procedure na to, don't forget to introduce yourself to your client, explain hand hygiene before you start this procedure. Una natin kukunin natin yung temperature, and before that, sanitize muna natin yung hand natin. Lagyan natin ng alcohol. And also, yung supplies na gagamitin natin dito is relo and thermometer. And meron tayo dito ng thermometer. Siyempre, bago natin kunin yung temperature ng clients natin, kailangan muna natin i-sanitize itong mga supplies na gagamitin natin. So, pag maglilinis tayo ng thermometer, mula dito sa clean area, papunta sa dirtiest area. Okay. And kung kinakailangan gumamit ulit kayo ng isa pang wipes or tissue, go. Okay. So, kukunin natin yung temperature ng ating clients. Sir, i-place ko lang po itong thermometer sa 3 kilo. Wait lang natin na tumunog yung thermometer para makuha na natin yung results. So, tumunog yung thermometer natin. So, tingnan na natin yung result. So, 36.3. So, okay naman. Normal. And next naman natin kukunin naman natin yung kanyang pulse rate. So, hawakan lang natin yung radial pulse, yung radial area, and doon natin kukunin yung kanyang pulse rate. Kapag magkukuha kayo ng pulse rate, yung paghahawak nyo dito sa area na to as hindi madiin. Dapat smooth lang. Para mas ma-feel natin yung strength and yung rhythm ng pulse. The strength of the pulse must be 2 plus normal, and yung rhythm niya is kung irregular, kasi we have two ways of performing getting pulse rate. Pwedeng, kung regular naman yung pulse ng patient mo, pwede yung kunin yung pulse rate niya in 30 seconds and multiply it by 2. Pero kung irregular, get it for about 1 full minute. So, place lang natin yung kanyang hand dito sa abdomen. So, okay. So, yung pulse rate niya is 83. Record lang natin. And now, what we're going to do is kukunin naman natin yung respiratory rate. And sa part naman na to, hindi niyo na kailangan sabihin pa sa patient na kukunin niyo yung kanyang respiratory rate. Pwede niyo na siyang isabay habang kumukuha kayo ng pulse rate pwede niyo na siyang isabay kapag kumukuha kayo ng pulse rate. So, place lang ulit natin yung kamay dito sa abdomen para ma-feel natin yung movement kapag humihinga yung pasyente. So, ang bilang natin dito is inhale, exhale is equivalent of 1. So, kukunin natin yung respiratory rate in 1 full minute. Okay. So, respiratory rate is 16. Record lang natin. And after natin makuha yung kanyang temperature, yung kanyang pulse rate, and respiratory rate. And after that is, tapos na yung ating TPR plotting. What we're going to do now is we're going to sanitize our equipment, yung mga ginamit natin, and perform hand hygiene. This procedure will show you how to use Glucometer. But before that, what is Glucometer? Glucometer is a device that is used to measure the blood glucose level. It is a key element of whole blood monitoring, especially by people with diabetes or hypoglycemia. To know the procedure, just follow these steps. Prepare these items. Check to make sure the insulin and test tubes have not passed their expiry dates. Next, calibrate the glucose meter. avoid touching the needle. Replace the lancet cover carefully. Prime the lancet device by pressing the release button. 6. Prepare the glucose meter. 7. Test your blood glucose level. Wipe one finger with an alcohol swab and let it dry. Press the lancet device firmly against the side of your finger. Push button to release the needle. Squeeze your finger to get a drop of blood. Touch the end of the test strip to the drop of blood. Apply a dry swab over the puncture site. Wait for the result to show on the screen, and that would be your blood glucose level. Record your result in your blood glucose diary. And that's the end of the procedure. Don't forget to remove the lancet cover and wash your hands again with